Out of all the reindeers, you know you're the mastermind. Run, run, Rudolph. Randolph ain't too far behind. Run, run, Rudolph. Santa's gotta make it to town. Santa, make him hurry. Tell him he can take the freeway down. Run, run, Rudolph, 'cause I'm reeling like a merry-go-round. Said Santa to a boy child, what have you been longing for? All I want for Christmas is a rock and roll electric guitar. And then away went Rudolph, whizzing like a shooting star. Run, run, Rudolph, Santa went to make it in town. Santa, make him hurry, tell him he can take the freeway down. Run, run, Rudolph, reeling like a merry-go-round. Run, run, Rudolph, Santa's gotta make it to town. Santa, make him hurry, tell him he can take the freeway down. Run, run, Rudolph, I'm reeling like a merry-go-round. Said Santa to a girl child, what would please you most to get? A little baby doll that can cry, sleep, drink, and wet. And then away went Rudolph, whizzing like a saber jet. Run, run, Rudolph, Santa's gotta make it to town. Santa, make him hurry, tell him he can take the freeway down. Run, run, Rudolph, I'm reeling like a merry-go-round.
Rocking around Good morning and welcome to our end-of-year town hall. I'm joined here in Hingham by a few hundred of our colleagues, thank you. And I want to welcome everyone who's watching online in Quincy, at 101, or at home. I'm excited for us to be together, excited to celebrate another really great year here at Blue Cross, thanks to you. This success is especially notable because we have a growing and more intense competitive environment, one of the most competitive I've seen in my tenure as CEO. So here's what we're going to cover this morning. We're going to take stock of the year of 2019. We're going to look ahead to our plans for 2020, and we're going to hear what's on your mind. So I encourage you to start thinking about questions or comments as you listen to the discussion. So as we begin, a refresher may be useful. 1 year ago at this meeting, we shared an updated strategy for the company. You see it displayed here. We reviewed our mission statement and affirmed our intention to really work everything around our consumers and our members, put them at the center of everything we do. We also made clear that new and deeper partnerships with other players in healthcare would be essential to delivering our commitment to give our members an unparalleled experience with our company and in the healthcare system more broadly. Now, at the time, we were thinking more about deeper partnerships with physicians and hospitals, and you'll hear about those in a moment. But over the past year, we've also been thinking about different partnerships with other players in the healthcare system, and we'll also cover that today. So with that background, let's talk about 2019. I've asked 4 of our executive leaders to join me for this portion of the meeting. I'll introduce them briefly as they come up to the stage. Pat Gilligan is our head of sales, marketing, and product. Stephanie Lavelle is our chief legal officer and also heads our Medicare program. Rich Lynch is our chief operating officer. And Andriana Santangelo is our chief financial officer. That's better.
Right? Feel good?
So I'm going to join this team for a little conversation, and I'm going to start with you, Pat. So just summarize for us kind of the biggest, most notable accomplishments in 2019.
Well, Andrew, even with all of that competition that you talked about, I'm very happy to report that we were 90,000 members ahead of plan in 2019. It's extraordinary performance. Stephanie will talk to us about the Medicare performance. That 90,000 is across all of our segments. We outperformed in the commercial insured. We outperformed in the commercial self-insured. We even outperformed in muni and labor, where we're already very strong in the marketplace. We were behind in merged market, but all the other segments really lifted us up, and it's just great performance. We also have some momentum going into 2020. Especially with some of our larger wins for 1/1/20. You can see here who they were, but just examples are EMD Millipore, who shares this campus with us for one of their headquarters. Harvard University is a very big win. But also some of our longer-term customers are also adding lives to us. The New England Carpenters and the Mentor Network all had significant growth for us in 2020. So I'm happy to report that we have momentum, which is very exciting. And even with all that growth in the medical, what's even more exciting is that we're also selling more of our ancillary products. We started that program years ago to really cater to smaller employers who needed help to acquire dental and vision and life and disability. More and more, the larger employers are looking at our offerings and really buying up from us so that we're not just a medical company anymore. I just want to also recognize that when you add 90,000 members, that's a lot of burden on the company, and I think it's a testament to all of us that we've been able to bring them on successfully, so I want to thank everyone for that.
Thanks, Pat. That's a great report. So, Stephanie, same question for you, kind of highlights 2019 from Medicare?
So in Medicare, we grew in every single product type that we are in, and it's an intensely competitive environment. In fact, I think my slide's going to come up. In Medicare Advantage, which is a real focus point for us, we grew more than anyone else. We captured 40% of that market. And we are now in our 81st month of continuous growth in Medicare Advantage. I think the pie chart also shows, though, the other side of the coin, which is the market is more competitive. Aetna, which just rejoined the market a year ago, itself captured almost 38% of the market, which shows the intensity that they put on this marketplace. And United, everybody's seen the thousands of United ads that air every night, is not going to go away. So we have the twin aims of we did great in our growth, and we also need to stay very competitive in a very competitive market.
Thanks, everyone. We'll come back to looking ahead at 2020. Rich, Pat mentioned big burden on the company to accommodate all these new members, but from your perspective, what were the kind of the top issues in operations, technology in 19?
A couple of things come to mind. I guess I'd start with the results that we heard from Pat and Stephanie. We'll hear a little bit from Adriana in a minute. Happened because of the work that everybody here is doing across the company. There's more burden. We're really good at what we do. You all are really good at what you do for us in operations and claims and maps and provider servicing and so forth. Across the company, there's by any measure, we're really good at what we do. We're one of the best in Massachusetts. We're one of the best across the country, and that's because of the work that all of you do. So thanks for that. A second thing, maybe a little less intuitive, good companies, high-performing companies have a lot of things in common. One of them is an ability to think about and prioritize and sometimes say no to projects. And it's a skill I think we've done some work on, and we're getting better at it. We made a big decision this year, one of the biggest projects we've had in the company's history. Some of you know it as Members Edge. We made a hard decision to say no to that this year. And that's a really important skill to continue to build going forward into next year as well.
Thanks, Rich. So Adriana, everyone always wants to know how our financial results are going to come out in 2019. I know the year is not totally over, but how does the year end look to us?
First, the mic people told me to flip my hair so it doesn't get involved, and so I'm going to do that.
I wish I had some hair to flip,
As you've already heard, 2019 was a strong year, and our financials show it. Our operating income is expected to be about $40 million, which is slightly behind plan, but within our expectation. Our investment income came pretty close, and so on a total net income basis, we're going to be at about $108 million, which is a very modest gain that we actually need in order to keep maintaining and investing in the business. Pat has already mentioned both the medical and dental growth that we've had. It's just been a phenomenal year. What I want to say about these results, though, is that these probably won't be the numbers that you'll see when we get to the final reported numbers. There's some extraordinary items, special items that are both planned and unplanned that we'll be reporting on that really kind of skews and distorts how we actually measure our performance. And so those are not included in here. But by the time we get to year end, as we always do, we'll send out the communication and give you guys a better sense for where we land. But all in all, we should really feel good about where we landed for what we're projecting for the year.
Thanks, Adriana. Just a quick follow-up. There might be 2 or 3 people in the audience that are just wondering a little bit about the status of our incentive plan for the year. Oh. And so just for those 2 or 3 interested people, if you could...
I did not plan for that question at all. But it should be no surprise that across all 4 of these measures, given what you heard, that we're either at or better than our expectations. So obviously the year's not over, the final tallies aren't in, and our board does have to have a vote on this, but it's looking really good, and I think you should, go ahead, budget a little over this year for your Christmas spending.
Right. So as you heard from each of our leaders, a great 2019. Let's turn the page and talk a little bit about 2020. So to frame this conversation, I asked our Chief Strategy Officer, Sukanya Soderlund, to share some of the key issues and trends we're seeing in the market. So watch this.
There are major changes happening in healthcare today. The competition is intensifying and accelerating. There are 3 major changes that are impacting us. The big are getting bigger nationally. They're moving from health insurance into other spaces: retail pharmacy, PBMs, care delivery, digital health solutions. In our backyard, we've got Tufts and Harvard Pilgrim slated to merge and come together. We've got a whole host of startups across the country that are trying to recreate the payer model, trying to make it better, faster, cheaper, smarter with more technology. And we've got the big players from the Googles and the Walmarts and the Amazons of the world that are also trying to get into healthcare. Consumers' expectations are rising as well. Costs are a major burden. People are digging deep into their pockets to try to pay for healthcare as the rise of high deductible plans has become more of the norm. And people are looking around at other parts of their lives outside of healthcare where with a touch of a finger on their phone they can get what they want when they want it. And they're starting to expect that in healthcare as well. Employers are getting increasingly frustrated with the cost of healthcare. So they're starting to move from fully insured business to self-insured to try to take more control of the healthcare dollar themselves. They're starting to ask for more a la carte benefits where they can pick and choose what they want. And sometimes they're going around the health plan to different vendors to provide the services that they think they need for their employees. While all these challenges and changes may be daunting, they also present great opportunity for us. We've got confidence that we have a clear path forward and a robust strategy roadmap that's going to build on our strengths, leverage partnerships, and seize a whole new set of opportunities that are emerging to deliver on our mission, driving quality, affordable healthcare with an unparalleled consumer experience.
Thank you, Sukanya. So I know our leadership team is keenly aware of these trends, and so I'm going to ask each of you to share a few insights as your teams finalize your plans for 2020. So Stephanie, given what's going on in the market and the competitive environment, share us some of the highlights for Medicare for 2020.
Well, I think I want to go higher than the highlights and just say that it's really easy to think that we're the underdog because in some ways we are. But any of us who have watched sports realize that the underdog can win. So how do they do that? First, they get a game plan that really capitalizes on their strengths. And we have a lot of them, including the fact that we have the most commercial members, and so that blue-to-blue pipeline in Medicare really can capitalize on our strength. The second is they keep their head up and look around and make sure that they tweak their plan throughout the game and don't stay stagnant. And we continue to scan the market and try to improve upon the benefits that we have. And finally, the third most important thing, don't get freaked out every time the other guy scores a run. And that's what we really all have to do. We are in a very challenging environment, but we have the capacity to win, and we are going to win.
Pat, 2020, kind of as you look forward, and especially given the competitive environment.
Yeah, well, very similar to Stephanie's comments, we should remember that despite all of this competition and these new disruptors of the marketplace, our value proposition is resonating in the marketplace. And one of the things we're going to do even more of in 2020 is really sell our integration across medical, dental, vision, life, and disability. We've been doing that for a while. It's becoming more integrated. That's something that we can do that many others can't do. They don't have all of those things, and they can't pull it all together the way that we do. We're also going to be introducing new products as we do every year. Just one example, something I'm very excited about, is a new app called Live to Learn. It's filling a gap that employers have been asking about because we know so many employees and family members have stress and anxiety and can't get access to care. So it's an online app for our members to be able to get access to those services, which is going to fill a real need. And then also, we're going to start communicating differently with our members. People may or may not know that we've been really trying to get members to register for MyBlue. 2 years ago, we had 40,000 members on MyBlue. We are now up to 500,000. We have 500,000 members that are registered for MyBlue. That's an incredible channel for us to reach out and to engage with our members. I'm really excited about that.
Thanks, Pat. That's an extraordinary change over a short period of time. Rich, as you look ahead for 2020 and look at some of those themes that Sukanya mentioned about the competitive environment and about affordability being central for our customers and our members, what are the priorities for your group?
So I guess there's a lot going on across the company. There's three things that come to mind first. The first is affordability, right? So our customers are putting more and more pressure on us to make sure that we can provide affordable products out there. The work we're doing across the organization, especially in places like provider network management and contracting and in HMM and case management, utilization management, and some other new programs that we'll be rolling out into 20 are going to play a big, important role in that. So that's one really big, important thing. A second thing would be our tech portfolio. It's a really big piece of what we do every day. It touches what we're doing in enterprise technology, but it touches the whole company. We've got a big portfolio. We've got over 110 projects again this year. We've had a few years in a row where we've got a really packed full technology agenda, and there's still things in the queue beyond that. A lot of work still to be done there, and we're working on it, saying no is going to be part of that going forward. And then the last thing I guess I would say broadly, we've got to continue to focus on the business every day. We're functionally excellent. We do a lot of things really well. I think you'll be hearing more from me over the course of 20 about projects aimed at trying to get us to be a little bit better cross-functionally, and more to come on all of that.
Thanks, Rich. Andriana, looking ahead to 2020, biggest issues?
Well, I just want to display sort of the financial targets that we have for 2020. Excuse me. So the financial plan really tries to balance both the needs to have as affordable premium as possible in the market, but also the need to make a modest net income margin in order to keep investing in our business. So as you can see, the operating income is really break even for the operations with the range around that. Our investment income is going to generate about $76 million, and then with some some tax credits, we have a net income number that's pretty darn close to what we had for 2019 as well. The things that I'd like to point to is we also have some really challenging membership goals, both on the medical side and on the dental side. On the medical side, 20,000 member growth, which takes a lot to even get to, because we know we have some renewing business that terminates and some business that we need to acquire. But the milestone here is on the dental side. We're looking to achieve for the very first time 1 million dental members, which is going to be very exciting.
Thanks, Andriana. So earlier, we talked about the role of partnerships and how essential they've been both in 19, but even more important going forward, given our agenda around affordability and putting the consumer at the middle and this new intensifying competitive. So, Rich, maybe I'll start with you. We've talked a lot about partnerships with providers. We launched a big one with Atrius this year. Give us a little status report on how that's going.
Yeah, great. It's first one. Launched in the beginning of the year. A lot of work going on across the organization, and together with theirs, it's going well. Two highlights, I guess I'd point out. One, we collaborated with the senior folks at Atrius to do a Atrius-focused product and to offer to one of our new clients, Wayfair, bigger clients, to put Atrius sort of on site there and try some different things. So I would point that as one highlight. The other is we just launched this week a telehealth project aimed at with Atrius, aimed at improving our access to behavioral health using the Atrius providers. Launched this week, and I'm excited to see how that plays out. One last thing, heading into 20, we've got a few other things on the list. A couple of other providers. We're not ready to talk about it yet, but I hope by this time next year, we'll be talking about some at least one additional provider partnership.
Great. Pat, from a commercial perspective, could you talk a little bit about what partnerships you're considering and your team is considering, especially can we look forward to any Blue partnerships?
Yeah. So I'll touch on the Blue partnerships, but I also wanted to just talk a minute about some of the disruptors that Sukanya talked about, because we all worry about the Amazons and Googles sort of getting into the space, but there are ways that we could possibly collaborate with them. And so people may have seen that we announced a new agreement with PillPack. PillPack is a unique pharmacy distribution model that was acquired by Amazon, and we are the first in the nation health plan that's integrating PillPack into our app, which is for members with many medications. And so I just offer that as an example of something we're just starting now, but I think these disruptors can actually help us to accelerate our strategy, and we'll look for those kinds of partnerships going forward. And then as you mentioned, Andrew, at this point in time, as we see all of the consolidation with CVS and Aetna and Express Scripts and Cigna, it's really resulted in a time where I see more and more collaboration and coordination among the 36 different Blue plans, and I think that's a good thing, and we're going to need to do that. We are in discussions with many of them right now. It's a little too early to say who we might end up partnering with, but I think we're very aligned with many of them in terms of our strategy, and we're going to recognize that we can't always do things on our own, and we need to partner with others. And if other Blue plans can help us advance our strategy, then we'll do that.
And I would point out we already have a deep partnership with NASCO with a set of 4 other Blue plans that's been very helpful to us and it's given us some scale that we wouldn't have otherwise. Stephanie, how do partnerships play out in the Medicare space?
I think in Medicare it's really important to start with the premise that the member, him or herself, is the one making the decision. There's no employer in the middle. And so they're a consumer, and they're bringing consumer expectations to everything that their interactions with us. And what we've recognized is even if we do everything in our power to delight members, the interface between us and their providers is the thing that often frustrates them. And so what we're working on in our partnerships is breaking down that friction, making it a lot easier for them to navigate both us and their providers, and together bring greater value to the combined relationship. And that's really where we're going to spend most of our time.
Andriana, in the video, Sukanya mentioned that the big national plans are kind of bulking up. So how do we think about competing and achieving scale against these large publicly traded organizations?
So I think the reason why partnerships are so important is to really try to combat and compete with those kinds of large entities. The idea of partnerships is really to take advantage of pooled financial resources. And it makes sense. You could either invest a bunch of money on a single source or find like-minded partners that are pooling the financial resources, small investments to get to a common problem. So Andrew already mentioned NASCO. This is not new for us. It's just taking a new sense of urgency and to find common problems across Blue systems, across providers, to really pool the financial resources to get to a better result and share ideas and get to a better result.
Thanks, Andrea. So lightning round, final comments about 2020, Pat?
So one last thing about 2020 that I'm excited about is we've been socializing this new strategy with ourselves, with our associates for the last year with this focus on the consumer. And now we think it's time that we socialize it externally to all of our constituents, to consumers, to employers, to brokers. And we're going to do that in 2020 through a refreshed brand launch, which I think it's time for that. If people might notice, if you're on the T or driving on the expressway, you're seeing many of our competitors, local competitors. Harvard Pilgrim is advertising heavily. Always Health Plan is advertising heavily. Stephanie mentioned that United that we see all over the airways at night. And it's time for us to go out and sort of plant our flag in 2020. And we plan to do that with the B that you see behind me, which we've introduced here, but we haven't introduced it externally. And that B is meant to say, what are we for? What is Blue Cross for? And we know that we're for service, and we're for clarity, and for anticipating our members' needs, and we're for empathizing with our members. And you're going to see this B out in the marketplace, sort of embracing our members. And I think it's going to be a great way to tell our story and plant our flag.
Stephanie, final thoughts, 20?
20 is really about executing the plan for 20, but it is much about thinking about what 2021 needs to look like. We are now trying to understand what benefits are really resonating in the marketplace. It's really easy to throw out the kitchen sink and think we should do all the things that our competitors are doing, but we need to be smart about our resources, and we need to pick the ones that will most resonate and the ones that will really delight our members in the right way.
Rich, final thoughts on 20?
Sure. So we have a really nice culture here. One of the first things it made an impression on me getting here in this past year, and you all have done nothing but confirm that for me over the course of the past year or so. And that's because of all the hard work you have all done around creating a really inclusive work environment. And for 2020, one of the things I want to do more of, and you'll hear more about from me over time, is sort of doubling down on what can we do to make it even better from a diversity and inclusion point of view going forward.
Great. Andriana, last word on 20?
So I can't help but think about how we got here and thinking about 2019 and how it will propel us into 2020. And the same themes are going to emerge. We have a challenging environment. We have to stay vigilant about how we use our administrative cost dollars that our customers pay for us. We have to keep differentiating ourselves with the highest quality, most affordable, highly valued products. And we have to keep giving you the tools and training that you need to really deliver on all of these goals. You know, there's a great Tina Turner song that very well described this organization and all these associates, and it captures exactly what we are.
You're simply the best.
That was delayed. You're simply the best and better than all the rest. So thank you.
You know, we had a little meeting to prepare for this, and Andrea would not disclose to us what song she chose, so it's like her big surprise moment. So be sure to tell her or give her a little feedback on her choices and selections. So when we put together this meeting, I didn't want to just talk about how we're putting the consumer in the center of everything we do. I wanted to show it. So we actually hired a former top TV reporter from the Boston area to go and talk to our leaders about what are we doing practically, how are we putting the consumer in the center of everything we do. So take a look at what he found.
We've spent a tremendous amount of time listening, learning, and hearing from the members we serve. They want better clarity of how the plan works and how to navigate it and really understand in a very clear, simple, and easy way so that healthcare is as convenient as possible when they're in a time of need.
There was just this real visceral reaction from them around how difficult it is to navigate the healthcare system. Not just Blue Cross, but the healthcare system, and how it feels like a black box.
In short, the research has uncovered that members want Blue Cross Blue Shield to be their ally, to help them navigate an often frustrating and complicated healthcare system. In response, the company is undertaking a major multi-year effort to redesign and reimagine the member experience.
It starts to becoming a companion where you want to look up your card, you're at the doctor's office, you don't need to carry the plastic.
Creating a consumer-friendly digital experience that can anticipate a member's needs is one area of focus.
When you launch the app or when you go to the website, the first experience is very welcoming.
Vijay Kukreja leads the company's digital experience work.
And it's very personalized once you log in. And then it starts explaining to you how much you've paid for your claims, how much we've paid, and it gets into looking at your medications.
Prescription drug coverage is the benefit members use the most. And so in addition to the work on MyBlue, the company is also partnering with innovative companies like Amazon to simplify the experience.
We looked at the value that they bring, which is really making it simple for people who take multiple medications to understand when to take them, how to make sure medications mix appropriately with each other in a really simple, convenient, easy way.
The company also is creating a one-team approach to better serve members who may have both a customer service question and a clinical need. For example, a new program provides instant alerts when a member goes into a hospital or is released from a hospital, so Blue Cross can connect them with the support they need. Kathy Gardner runs clinical operations.
This year we adopted actually new technology. We refer to it as ADT, which is Admit, Discharge, and Transfer Real-Time Notification. We have seen a significant increase in member engagement because that's when they want to talk to the nurses in their insurance company, is to help them coordinate benefits and care when they're in the middle of a healthcare issue.
We now engage with members through a variety of channels. That includes live chat, that includes engaging with them on social media, email, and of course, phone calls as well. And we're getting better at understanding how members want to engage with us through those channels.
Ryan O'Donnell heads up member service.
And we're using the data in meaningful ways to get folks the answers that they need, to understand how a lot of our back-end processes and functions are critical at those moments to be able to deliver good service.
Okay, so you're calling to see if you're covered for diabetic testing materials? Sure, I can look into that for you.
With its Medicare membership growing, the company is paying close attention to making sure the experience is consistent and seamless as commercial members age into Medicare.
It is a complex process, and we want to ease that burden for our members and make that transition as simple as possible. We want to make it transparent. We want to reduce the complexities and be there for our members.
Katie Oliver is part of the Medicare team at Blue Cross, which is coordinating innovative care for vulnerable Medicare members so they can get what they need at home and avoid trips to the emergency room.
Other programs that were either launched in 2019 or continued in 2019 for beneficiaries is the Landmark program with HMM, Community Servings, which delivers meals to members, as well as telemonitoring that was launched in 2019. So we launched telemonitoring and community servings and continued with our Landmark program to support members.
So they have the phone number for dental provider services.
The company is working on how best to package these member experiences when it launches a major brand refresh in early 2020.
What we're going to do is begin to put a spotlight on all the incredible things that we do today that are delivering on that promise, as well as build a runway for all the things that we're going to do in the future. I hope consumers walk away and say, wow, I didn't know Blue Cross could do that for me. I didn't really realize that that was what I get with the plan that I have today.
So, what do these Blue Cross leaders hope associates will take away from this multi-year effort?
Well, I hope they understand that we are putting our member first and doing everything we can to support them to get the best care at the right time in the right place.
I hope they get excited about who we are today and who we are as a company and this incredible strength that we're building from, but also really excited about the future.
I'm talking about being first empathetic and understanding why the member's contacting us, putting ourselves in the member's shoes, and then also, of course, being a problem-solving kind of mindset.
We continue to invest a lot in personalization. I would say PillPack is a great example. The medication lookup tool. And the next step is to start interacting at a one-on-one level, making sure we can guide you to the right care at the right time. And that's really a big frontier I think we are stepping into.
It's really about how we're working together as an organization. Our success will be determined based upon how members feel about Blue Cross Blue Shield. And the more we listen to them, hear what they're saying they need out of us, and design around them, the better we're going to be positioned in the market, as well as deemed as successful from their point of view. So it's really the way we work together cohesively on behalf of providing that unparalleled consumer experience.
So I hope you feel the same momentum I feel about the work we're doing around the consumer experience, and again, putting our members at the center of everything we do. So I know you've been listening for a while. Now it's your turn to ask questions, give comments. I'm going to invite Jay McQuaid up to the stage with me, my Company Connect partner, and where he's going to facilitate a Q&A.
Sounds good. So I would say there are three ways that you can share a comment or a question. The first is you can text us a question. The number is on your screen, 617-390-7068. All of this will come to my handy iPad here. So texting is one option. If you're watching at your computer, you'll notice there's a Q&A button, and you can just simply click on it, type a question or a comment. That too will come here. And then if you're here in the room in Hingham, we've got some microphones set up, or if you're in one of our viewing rooms up in Boston or Quincy, just simply put up your hand and your host will see that, and we'll make sure we get your question. I want to just make a quick comment that big thank you to those of you who sent questions in advance. We had more than 50 questions submitted prior to the meeting, and as you might imagine, there were some themes that emerged, and so we did our best to go through the questions and kind of put them together, and so we'll filter those in as we take live questions. But a big thank you for those who did that. And if you submitted a question and we don't get to it during the course of this meeting, be assured that we've routed your question to the appropriate owner in the company to make sure that we get back to you with an answer. So thank you again. So with that in mind, and again, we'll keep the text on the screen, and so people can send them in as they come, and I'll keep an eye on my iPad. A couple of themes that came through in the submitted questions. I would say the one that jumped off the page the most was people interested in hearing more about the merger between Harvard-Pilgrim and Tufts. So how are you answering questions about that merger, what it might mean to us?
Sure, Jay. Well, Harvard and Tufts are already strong competitors in our local market today. There's going to be months of review, regulatory and antitrust review of this proposed merger. And remember, they're multi-state organizations, so it's going to have to be reviewed by most of the New England states, but ultimately here in Massachusetts. I think if it's approved, they'll be formidable competitors. They have a kind of some complementary areas. Tufts is stronger in public markets like Medicare and now Medicaid. Harvard Pilgrim's stronger in commercial markets. But it's just another signal to us that we just have to continue to up our game. And as Andriana said, we have to be the best. We are the best today. We have to continue to improve.
Interestingly enough, another big theme in the questions that came in are now showing up in some questions as people type them in. And the question is this theme around the 2020 election, the campaign, the debates in which insurers, if you've been kind of watching some of those debates, haven't exactly been characterized in the most positive light. And this notion about, Andrew, moving to a Medicare for all system. So I think one of the questions folks are asking is, how do you answer the question about Medicare for all and how insurers are being characterized?
I only get that about 5 times at every cocktail party I go to. But before I answer that question, I just want to say that I am so proud of this company, so proud of our values, the way we treat our members and customers, the work we do in the community. So I hope you're proud too. And anytime you hear something said, it's hard in a political environment about health plans, just think about the work we do and take pride in that.
Amen. Amen.
When I'm asked about Medicare for all, the first thing I say, it's an important debate to have. We still have 30 or 40 million Americans who wake up every morning without health insurance. It creates a lot of stress and anxiety and results often in people seeking more expensive care in emergency rooms rather than getting the primary and preventive care they need. So we ought to have this debate. I then point to what we've done in Massachusetts, where we have, as a result of work by this company and others in the community, have 97 or 98% of the adults covered. 100% of the children in Massachusetts have health insurance. We've done that without a huge government involvement, the way Medicare for All would suggest. We've done it public and private sectors coming together, balancing together, working together. I think that's probably the best route for this country. We probably need a uniquely American solution that combines the best of the public and the private. We have the Affordable Care Act. We should probably build on that, work on that, make it even better. But don't shy away from the Medicare for All debate. Be proud of what we do and say we're open to other people's ideas. We ought to bring health insurance to everyone. We have a model here in Massachusetts that's working well, probably should be replicated around the country.
Here's a great question. So the writer notes that we've heard a lot about accomplishments and achievements in 2019, but says, what is the biggest missed opportunity this year?
Missed opportunity. Well, we talked about partnership with providers, and we had some great work that Rich talked about with Atrius. I'd like to do even more. I look, and when I see clinicians in the community, they're burnt out, they're frustrated by the administrative overhead, and simplifying the healthcare system is kind of built into our strategic plan. I want to do more work on that. I want to see what can we do to simplify the system so clinicians who really went into the field because they feel empathy and compassion for their patients are kind of liberated to do that and don't have to have the kind of paperwork hassles that the system overall creates for them.
So a couple of questions in the same kind of category having to do with the work here at Blue Cross. A number of questions coming in about the announcement the company made related to changes in our pension program and our retiree medical program for new hires who start with the company after the first of the year 2020. And the questions sort of get to the point, which is, are there any plans for changes for those of us who currently work for Blue Cross?
No. Next question? No. No, really, we took a hard look at our benefits, and when we look at our benefits, and we did this in conjunction with independent consultants and our board, we saw that our retirement benefits are much more generous than most of the local competitors and other high-performing companies like ours. We didn't want to disrupt the promise that we've made to our current employees for our pension, and so that's not changing. But we looked for what are our new employees, especially younger employees, want, and it's less about pension and retirement and more about things like paying down college debt, about having great health insurance. And so we're kind of reorienting our benefits a little bit. We've done some exciting things over the last few years in college repayment, so we're going to focus on that, but no changes for current employees for your retiree benefits, both pension and medical.
a surprising number of questions about how we work at Blue Cross. And I think there's a lot in here about mobile workforce. And Andrew, interesting questions about as we shift to become a more mobile company. And frankly, we're working that way today.
Right.
How do you think about the importance of continuing to keep the culture that we have, to continue to collaborate and partnership, and what's your general worldview about mobile working and how we work as a company?
Well, it's a balancing act, and I think we've tried to achieve it fairly well. On the one hand, Jay mentioned culture. Our culture is so strong. Rich talked about it, and we want to continue to build that and live those values. And some of that comes from working together and from the colleagues and kind of really almost close friends we establish here in the workplace. On the other hand, and speaking to someone who has a big commute every day, we also want to be sensitive to the transportation kind of roadblocks that people face, the child care responsibilities that people have. And so we're trying to balance that. We're trying to give you the flexibility you need to work in a way that works best for you and your family and your lifestyle, but also hold on to that culture. And so when we have people who are working principally either e-workers or working mobily, we want to try to bring people in as much as we can so they can still be part of that culture. We're also trying to use technology better. And there are companies that have great cultures that are national companies, even global companies, who find ways to connect through technology. And so as we have better technology to support us, I think we can be even more flexible.
So one of the big issues in healthcare today, as you know, we hear about it, we read in the papers at the state level, at the federal level, is how do we help people get access to mental or behavioral health treatment? Big issue today, public policy issue. The writer, our colleague, writes in about what are we going to do specifically to help our members get access to those services without long waits or long waits in the ER and get access to mental health inpatient beds.
This is a really important issue to me personally. It's something I've worked on for most of my career, but also to our leadership team, to our customers, and to our members. Pat mentioned this new app we're offering to some of our customers, which helps with more day-to-day kind of stress and anxiety. But you know, at any time, probably about a quarter of our members are dealing with some kind of, challenging mental health issue or substance use issue or addiction issue. And we've done some things already which put us at the front, kind of the top of the class in terms of how we deal with this issue. Most health plans like ours carve out behavioral health, meaning they assign that responsibility to an outside vendor. We, about a decade ago, carved it back in, which means that our clinicians here in the company, psychiatrists, psychologists, social workers, case managers, are working side by side with their medical colleagues to make sure that we can manage people's mental health problems, because many people have a so-called dual diagnosis. They have a medical condition and they have a psychiatric condition, and if you don't manage those together, you're not going to really solve both their problems and actually lower healthcare costs. So we're trying to do that. We're also looking, frankly, at our fee schedule. We're taking a close look at that because there are a lot of, if any of you have, especially kids, who have had emotional problems, even trying to find a therapist for them or a social worker or a psychologist for them is really challenging. We've been doing a lot of work on our provider directories, both for our members' sake, but also because of some outside pressure from regulators and the public. And so we want to kind of continue to build our program in mental health and behavioral health, make it even better. And so look for 2020 for us to kind of try some new things and do some things differently, because this is a population of our membership which is suffering, and we want to try to get them help.
Thank you for all the questions. These are great. They are coming in. So again, if you're at your computer, type them in. If not, I think the text number is still on the screen. Text us a question. We're going to go to OED up in Quincy, where I understand we have someone standing by who wants to ask a question. So OED, you're on.
Good morning.
Good morning.
I'm Catherine Galasso, a trainer in the communication team of the Health and Medical Management Division. I'm wondering what impact for-profit hospitals will have on healthcare.
I didn't quite catch that.
For-profit hospitals.
Okay. Thank you. Great question.
I always have to back it up. So it's a good question. It was interesting. About 15 years ago, we had the kind of first entrance of for-profit hospitals in Massachusetts. First it was Columbia, then Tenet. We still have a few for-profit hospitals in Massachusetts that own a hospital in Worcester and one in the Framingham-Natick area. I would say, from my perspective, it's less about are you for-profit or not-for-profit, but what is your commitment to your patients and your community. So I think it's less about your corporate form and more about your community commitment. So we're willing to work with not-for-profit hospitals, which is still the prominent way of organizing a hospital. What I would say, however, is the place where the for-profit world is coming more deeply into healthcare is actually on the physician side. So you see private equity companies buying physician practices, especially in areas like emergency room physicians and others, hospitalists. And I do think we have to be a little cautious about that and be sure that what they're doing is always in the best interests of our members, their patients.
Great question from Quincy. We're waiting for you one-on-one. So keep the questions coming. Love this. Love going, Bill. This is the first time we've been able to go questions from other buildings. So we get communications. People get all excited about those kind of things.
I know. Calm down, Jay. Calm down.
So a lot of questions about something that happened during the fall, and we did a lot of communications about it, and the writer notes that I didn't really hear much after it got settled. What we're referring to is, you may remember that during the fall we had a challenging public contract dispute with one of the providers in the South Coast area, the South Coast Health System. So maybe that rings a bell, and got a lot of news coverage. And the writer notes, I heard a lot about it while it was going on. I didn't hear much about the outcome, how we felt about the agreement.
Yeah, great question. First, I would say thank you, because it took an extraordinary amount of effort and coordination, not just from our provider contracting team, but from member services, from communications, from our groups that work with municipal companies, with municipalities and labor. So it was just a classic case of Blue Cross coming together around something that could have been a major disruption for our members. And so thank you first to everyone. You know, Jay, the reason you don't hear a lot about this is actually kind of typical. And we go through this every few years where a provider organization makes an unreasonable request for rate increases. And we get into a negotiation. They usually don't go public. They're usually more private. But occasionally they do go public. And in this case, we organized both our customers in that region, our labor allies in the region, our municipal leaders, and I think we're able to negotiate a successful result. We don't actually put out the final numbers because those are proprietary and confidential, but suffice it to say we were very pleased with where we came out. And what we were very concerned about it wasn't just about South Coast. This was about setting a precedent, because South Coast made public their request for, it was a 12, 13% increase. It just was unsustainable in this kind of environment where our customers actually want us to keep costs down, not allow costs to rise at that level. And so we're pleased with how it came out, and great work by Rich Lynch and Matt Day and their teams to get to a successful resolution.
Let's go to 101 Huntington. I understand we have a question from up in Boston.
Good morning, Andrew. Good morning, Jay. I'm Larry Butler. I work in the underwriting department within the finance division. And my question is, how are we working to influence the discussion around healthcare politically at the local and national levels?
Great question, and thanks for the work you do every day. So healthcare is going to not just be active nationally, but it's going to be a very active year in the State House here in Massachusetts. Governor Baker has filed a major bill with several components, and a highlight of which is a proposal to actually increase payments to both primary care and mental health care, something we just talked about a few minutes ago. The Senate has followed with a few small bills, and then the House of Representatives in Massachusetts, is going to file its own kind of omnibus healthcare bill. So there's going to be a very vigorous debate in Boston. Some of it's going to focus back on hospitals, on community hospitals, especially a handful of community hospitals that are in low-income communities in Massachusetts that are really struggling financially for survival. So I think you'll see a lot of debate there. Nationally, it's, right now, there's one word for the national debate, and it's impeachment, so they can't really focus much on other things. Although, interestingly, a little budget bill came through and did repeal a health insurance tax and the Cadillac tax and a medical device tax that were key parts of the Affordable Care Act. So somehow, but despite the partisanship in Washington, they were able to get that done. What they didn't do was the really top issue for most the public. One is drug pricing, so we're going to see that come back in 2020. And the other is this problem of surprise billing, which is less of a problem in Massachusetts, though still a problem here, a big problem nationally where people go to the hospital and they and the hospital's in network, and then they learn that the anesthesiologist or the surgeon or the emergency room physician is out of network, and they suddenly have a huge bill. And I think there's a political consensus that that can't go on any longer, just a matter of what their best solution is. So nationally, you're going to still see a debate. One other thing I would say, there's a court decision on the Affordable Care Act that is going to come out any day, either the last few days of December or the beginning of January, that has the potential to repeal the Affordable Care Act. And nothing will happen this year because that whoever wins that case, it'll get appealed to the Supreme Court. But we're just going to have another debate about health care, both Medicare for all in the election, this court case, surprise billing, and then a big health care debate here in Massachusetts.
Question about whether we would consider expanding beyond our core. And I think the writer is talking more than just medical. Beyond medical, dental, vision, asking, for example, would we ever consider buying a health system?
Yeah. It's a good question, and some of our sister Blue plans have done exactly that. The plan in Western Pennsylvania bought a large hospital system. Plans in Florida and Texas are buying up physician practices. That's much less likely to happen here. Instead, what we're trying to do is these kind of deep partnerships like we announced with Atrius, and Rich suggested we're looking at some other partnerships here. In Massachusetts, most of healthcare is already consolidated into half a dozen large systems. And so I think it's less likely we do that. However, we may find some unusual opportunities, and we want to stay agile and open to new ideas. You heard from both Sukanya and Pat about disruptors, our work with PillPack and others. So I think it's more likely to see deep partnerships than actual acquisitions. But, you know, just a few years ago, we invested in urgent care with some other players because there was insufficient urgent care capacity at the time in Massachusetts. So we'll look for those kind of opportunities.
Okay, the next question is that was actually pre-submitted. So this writer really now he's asking, he or she is asking it again. I love it. So it's a two-part question.
Okay.
You ready?
Yep.
Greatest challenge to Blue Cross and greatest challenge to the industry. That's one. Oh, it's really two. And what keeps you up at night?
Okay. Well, I think the greatest challenge to the industry and to Blue Cross is the rising cost of medical care. I mean, there are extraordinary new discoveries that are being developed every day. There are some new medications, for example, one that restores eyesight to someone who's a child who's blind, which is extraordinary. Everyone, you know, what a breakthrough. It costs $1 million to $2 million a year. Other solutions in which literally our genes are mapped and then a drug is designed just for us, only for us to match our genetic code. Again, $1 million or $2 million a year. And we obviously want to encourage that kind of discovery, but affording it is another matter. And our customers, both our employer customers or individuals, they just can't bear double-digit increases. We've been successful in holding the growth in healthcare spending down into the mid-single digits, but some of these new discoveries, so that's an issue. What keeps me up at night, you know, other than, you know, the Patriots, the Red Sox, the Celtics, and the Bruins, is really this competitive environment. So you heard about it from Sukanya. It is changing. Our environment is changing, and Amazon and Google and CVS, you know, CVS is opening up literally probably thousands of these stores around the country, that it won't just be a pharmacy anymore. And so we have to figure out how to work with these entities, and Pat cited the example of working with Amazon through PillPack in a way that keeps our value proposition strong, but allows us to kind of build on some of the expertise that especially these technology companies can bring.
We're getting close to the end, but a couple more questions. One series revolving around innovation. One writer asks, we haven't heard much about the Innovation Center lately up at 101. By the way, here at Hingham, I'm just curious, show of hands, how many people know we have an Innovation Center at 101? Oh, okay. So for those watching, most hands went up. Great. So Innovation Center, we haven't heard about that lately. And then a similar question, the writer notes, we had an innovation challenge last year. Will associates have an opportunity again this year to suggest ways to reduce healthcare costs, help with partnerships?
Yeah. Well, so first of all, the Innovation Center is very active. We've had both a lot of internal teams going through work there. We had our Atrius partnership. They did work in there. We've opened it up to people in the community. We had a hackathon that MIT sponsored in the healthcare space. We had hundreds of people in there. We've had competitions. We've had other outside guests in. But the most important role for innovation, Jay, is really inside the company. And so we really want to use both the center, the team, but more importantly, the thinking as a way to kind of unleash our creativity and think, how can we do things differently in the company? How can we rethink our processes, our systems, our operations, our way of doing business with the eye of, again, putting the consumer in the middle. So we call it human-centered design. How do you design not around our needs, but around our members' needs? So I think what you'll see in 2020, we have a relatively new Vice President of Innovation who's already off to a great start. And I think you'll see both he and his team more active in the company, trying to involve you in our innovation process.
Great questions. Thank you for sending them in. I know we're getting a little tight on time. Maybe this is a good one to end. I'm sure we're all thinking about it and looking forward to spending time together over the lunch. The writer simply asks, Andrew, what are you most looking forward to over the holidays? That might be a good one to end on.
Clearly just kind of time with family, kind of rest, rejuvenate, go see some movies. There are a lot of good ones out. I haven't seen any in the last few months. So just kind of rejuvenation and get ready for a big year in 20.
Great. Thank you. Okay. And thank you for the questions. That was awesome.
So thank you, Jay, and thank you for the team that put this great day together. I guess I just want to close and remind you that as we look out into this competitive environment that I just talked about, we're still the leaders. We still have the national Blue Cross system that is in every zip code in the country, covers more than 100 million Americans. We still have the best brand in the market. We have the deep local partnerships that we talked about that no other health plan, no other company can achieve in this market. And then we have we have extraordinary people who power that. And just finally, I just want to say I'm just incredibly proud. We've touched on a little bit today of our values and our culture. Service to members, to our employer customers, to our physician and hospital partners, service to the communities where we live and work. And at this time of year, I'm especially reminded of how much time you take out to help those in need in our communities. It just speaks to that culture and our values. It's part of our DNA here at Blue Cross. So on behalf of our entire leadership team and really our board, I just want to say thank you for a great 2019. We'll be celebrating this great work at a special lunch here in Hingham, in Quincy at 101 between 11:30 and 2. So I want to invite you all to come back and have that. And finally, I just want to wish you and your families a wonderful season full of rest, joy, and peace. Thank you again so much.
You're simply the best. Better than all the rest. Better than anyone. Anyone I've ever met. I'm stuck on your heart. I hang on every word you say. Tears apart. So this is Christmas. I hope you had fun. The near and the dear ones, the old and the young. A very Merry Christmas and a Happy New Year. Let's hope it's a good one without any tears. So this is Christmas for weak and for strong, the rich and the poor ones. The road is so long, and so happy Christmas.